Okay, so if you notice, some of your papers have colors on them. So if you selected a paper that has a green, would you come up and join my circle up here, please? So all my greens, come up front. Okay, once you all kind of get settled in, you can pass the little bucket around and select an instrument, so you can use mallets with these. I have shakers on the bottom. These little things are called caterpillars. Right?
That goes all through my son's music class.
Yeah. Ladder pillar, like a caterpillar ladder.
Makes sense.
Squares, circles, triangles. I brought the big ones today. And then we have little, what we call chiquita maracas. Yay! All right, so what we're going to do is I have your directions up here. Basically, when I play, you play. When I stop, you stop. If I go fast, you play fast. If I play slow, you play slow. And then if I go quiet, you quiet. If I play loud, you play loud. Okay? Everybody? Cool? So just kind of follow and do what I do. Okay, so basically, let's have a little discussion regarding that music application and what was required of our musicians. So think about your bodies and what parts of your bodies you use. So what was required of our musicians? You can just shout things out. You don't have to raise your hand.
Had to listen.
Had to listen. Very good. So you had to use your auditory perception in your ears. Anything else? Attention. Very good. Attention. Movement, motor. So some instruments required 2 hands, some just required 1. The caterpillar was a little interesting because that was a little bit more of a complex motion. So listening, impulse control. So you had to be able to stop your body when the music stopped and start your body when the music started playing. Working memory required a little bit of problem solving. Oh, so when she told me to play quiet, when she played quiet, you had to be able to hold that piece of information and then use it to actually respond correctly to the music. Decision making, following directions. So we had a lot of those. Awareness of rhythm and tempo. So I noticed that our little group up there was pretty good about playing with the beat. And I don't know if anybody sang along, I couldn't tell, but if somebody decided they wanted to sing along, recall of the song lyrics. So, music in the brain. So here's a nice pretty little picture. We have our corpus callosum, which connects both sides of the brain. Now music is processed in both hemispheres. We have the motor cortex, so that's involved while we're dancing, playing an instrument. So with music, you not only have gross motor. For example, if you have someone playing the drum set, you have to have a full range, you have to have trunk, you have to have head control, and then you also have fine motor that you find in your pianists and other instrumentalists. Your prefrontal cortex controls behavior, expression, and decision making. So when you're performing a piece of music, you have to decide what your emotional content is going to be in it. You have to decide whether or not you're going to play fast or play slow. So those are very basic. Then you have your nucleus accumbens and amygdala, and that's your emotional reaction to music. How does music affect you emotionally? Some people may experience sadness, joy, happiness. Our sensory cortex, tactile feedback. So a lot of instrumental playing requires tactile. It requires your ability to memorize your body in space. So when you're playing a drum set, for example, you don't necessarily look at every drum you're playing. You memorize how that drum set feels in space, and then you can naturally kind of just, throw your arms out there and hit your targets. So that has a lot to do with tactile feedback, proprioception. Auditory cortex, that one's an easy one because music comes through your ears. It is also sensory in the fact you feel vibrations. So it goes in your auditory cortex and then it spreads out throughout your brain. Hippocampus, your music memories, experiences, and context. So if you notice you just kind of feel happy and you start singing a tune, you may have a happy tune, and you don't necessarily have to be looking at music or have to play an instrument or even hear it on the radio to recall those memories of music. Visual cortex, if you're going to be reading any music, watching yourself play an instrument, things of that nature requires your visual cortex. And cerebellum is your movement, dancing, playing. So if you're walking to music or marching to music, we're utilizing the cerebellum. Anybody have any questions about that? Okay, so what is music therapy? This is a very clinical, direct explanation. This is actually from the American Music Therapy Association. So music therapy is a clinical and evidence-based of music to accomplish individualized goals within a therapeutic relationship. It's done by a credentialed professional and who has completed approved music therapy programs. So if you happen to walk into a hospital and you see a musician playing the piano in their atrium or of some sort, they're probably not a trained music therapist. They're probably just a professional musician. So there is a specific degree at accredited colleges in which you get a specified degree in music therapy. So it is an established health profession. It's used within the therapeutic relationship. So if you come to receive music therapy, you are provided an assessment. You receive treatment plan. Families are engaged in the process. We also collaborate with other professionals, speech language pathologists, occupational therapy, physical therapists. So treatment protocols may include singing, moving, listening to music. It is designed specifically to the needs of each individual. So no two individuals have the same treatment plan. It's very person to person. So you have very degrees of differences in musical tastes and interests. So that would be taken into account when your treatment plan is put into place. We are not limited by age, and we serve individuals with mental health, those who may have developmental disabilities, autism, things of that nature. So our practice is not limited. So we focus mainly on assessing strengths and needs. And we use the most recent research to support our interventions. So how is neurologic music therapy different than music therapy? So NMT is a research-based system of 20 standard clinical techniques: sensory motor training, speech and language training, and cognitive training. Its treatment techniques are based on scientific knowledge in music perception and production, and the effects thereof on non-musical brain and behavior functions. So the big focus of neurologic music therapy is to understand how music works in the brain, and then how can we utilize the pathways of music to influence non-musical behaviors. So we're just going to, this is a little dry, we're going to interject another little activity here. So sensory motor. So in neurologic music therapy, we have what we call rhythmic auditory stimulation. So this is the rehabilitation of movements that are intrinsically rhythmic. Walking is intrinsically rhythmic. You don't have to think about, one foot in front of the other. You naturally get out of your seat and walk. It's intrinsic. And rhythmic auditory stimulation connects auditory with that natural biologic rhythmicity that we have. And it's used to help stabilize gait patterns who may have gait deficiencies or other neurologic impairments. So we have this technique called entrainment. Basically, you give somebody a beat and you say, I want you to walk to that beat. That person naturally falls into that rhythm. That is called entrainment. So they use the principle of entrainment to help with gait. Then another one here is pattern sensory enhancement. So in addition to those biologically rhythmic movements, you have those that are not. For example, clapping your hands is not the same as walking. It's different. Also, using your hands to hit instruments. It's different. It's not the same form of movement. And so this is a broader application. PSE, as it's known, utilizes harmony, melody, rhythm to diagram your movement in space. So for example, I had a young child who was diagnosed with epilepsy at a very young age, and he had very low tone, and when he was young, struggled to climb the steps. He was unable to go up and down the steps. We use pattern sensory enhancement to help him learn to walk up and down the steps. So you have upward movements, notes go up, downward movements, notes go down. And then the rhythm of the stepping. So you have to observe the rhythm, and then you create a musical experience that mirrors that motion. Unfortunately, it was so long ago, I don't have any video of him. That would have been something kind of fun to stick in there. Now, therapeutic instrumental music performance is playing of musical instruments to exercise or stimulate functional movement patterns. So if you go into a music therapy session and you may see somebody having an instrument hanging on a stand really high, or you have a pedal on the floor, you may have instruments set off to the side, they may be using therapeutic instrumental music performance. So it's using instruments in a meaningful way to emphasize range of motion, endurance, strength, functional hand movements, finger dexterity, limb coordination. And usually instruments are not played in their traditional manner in TIMP. So it may look odd sometimes if you see this. So what I'm going to do now is, if you have the color blue, please come and join my circle. Blue. So we are going to do a little TIMP application. Full house on this one. Okay, so I'm going to put a drum in front of you. Would you like one? Come on.
I have some blue on my shoe.
Oh, well, that works.
Perfect.
And you know what? We're going to use you later.
You want my card? You want to use my card?
Yeah, sit right there. Okay.
The one, there's, no, but there's different and blue. You want it, and that's why.
Okay. Well, I'm glad you came.
That's great, bud.
I'm doing this the hard way.
So what because my arms are very contagious.
Oh. I'm going to put yours off to the side, okay? In the front, and maybe a little bit to your outside of your knee here, and give you one. So there is a method to my madness.
Okay.
There we go. So for this, we're going to do a little crossing midline. So you're going to hold the stick in your right hand, and you're going to cross over your body and strike the drum that's to your left. Yeah, just give it a try. And you can pass this down. So everybody can have a mallet. Oh, and for you, I might have forgot a drum for you.
I
Okay.
think
well,
I
will
may
just give
not
you-
like playing.
Well, give it your best shot.
Okay.
Okay, here we go. Is that? So let's see. So you're crossing
Yeah, the first
over.
one.
I don't like.
So she's playing that. You're
Oh,
playing
okay.
this one. You're crossing over and playing this one. Okay. Do we got one too many? I got one too many.
No.
I think
Okay.
I don't like.
You're right?
No,
All right.
that's right.
Yeah, so
Okay, you
you're
want to buy your
actually,
outside knee, though.
yeah, you're
Yeah.
playing the outside knee, so outside knee, and so he needs one on the outside knee.
Okay.
I think I may
All right?
not like.
Well, do your best. Let's see. I have a better idea. How about if you put your stick in this hand, okay, and hold my lollipop drum, and try this. Give that a try. What do you think? Is that better? Or would you like to switch? Here, let's switch. Put that in there. And you can rest it on your lap. And here. Shall we try that? Give that a try. Now you got it. Bravo.
Good job.
Okay. So we're going to do a little instrument rumba.
That sounds fancy.
Sounds difficult.
Oh, yeah, it's so difficult. All right, so let me see everybody reach over and play their drum. And you can just, yep, there we go. Oh, I still have it. Sorry. All right,
I
I took
didn't
your
want to
drum.
say anything because.
All right, so everybody got to reach over, everybody? All right, just play along as you're crossing your midline. And you just play your drum. Instrument rumba. Do the instrument rumba. Do the instrument rumba. Get that dancing beat. Play your drum fast. Play it fast. Play that drum fast you can. Play your drum real fast. want you to be a little bit more deliberate. You're going to go up and down. So we're going to add a little range of motion to it. All right? Do the instrument rumba. Do the instrument rumba. You got it. Do the instrument rumba. Get them back Good. All right, let's switch hands and do it the other way. All right? You're fine. Oh, except now we're going to pass this drum back over here.
We're crossing, or we're...
Now you're going to cross but the opposite way.
Okay.
So now we're going to cross midline the other way. And we're going to trade an instrument here. Let me give you something. See, the instrument rumba needs some maracas. There you go. We need a little background rhythm. All right, you ready? So just kind of keep the beat while you cross midline. Motion. Play it really slow. Nice. Play it really slow. Now you gotta get that Latin back to tempo. Instrument rumba. Instrument rumba. Do the instrument rumba. Gets that Latin beat. Very good. Give our performers a hand. Nice, nice, nice. So I actually incorporated a couple things. We did some range of motion. We did crossing the midline. So if I wanted to be really fancy, I could give a high target. I could put some cymbals around, and they have to go ching, ching, and do it with different heights. Or I could have people stand up and move side to side and strike instruments, incorporating larger movements. So this has a lot of flexibility. This was just something really basic. Okay, thank you.
That was sort of the basic.
And excellent. You're excused. Until the next group.
Oh, yeah, that song's stuck in my head.
I'll be singing it all night.
All right, so we're going to move on to some speech and language interventions for neurologic music therapy. Melodic intonation therapy. This is for expressive aphasia. It utilizes a patient's unimpaired ability to sing. So this has, most of the applications for this are individuals who may have experienced a stroke and have lost some of their ability to express themselves verbally. However, if a person has the ability to sing, yet not talk, this technique incorporates rhythm, melody, and uses singing as a bridge to language. So it's very, very specific and has very, very specific steps. So if you had specific phrases that you wanted the person to learn how to say, like, I want some coffee, please. You design a musical melody that goes along with that phrase. You incorporate the rhythm of the phrase, the melody of the phrase. It also has a component of body percussion. So you are learning the phrase through multimodal ways, through the, having trouble with my brain, through the tapping. Okay, so it's very specific, and again, expressive aphasia. So not everybody, this technique won't work for everybody. Now, musical speech stimulation is you take songs, rhymes, chants, musical phrases that imitate our speech. It uses completion of initiation of overlearned familiar song lyrics, association of words with familiar tunes, or musical phrases to elicit functional speech responses. They give you a couple of examples. You are my... Very good. Okay, do we have any volunteers for a microphone? Any volunteers? Here we go. You're going to help us sing. All right, so we're going to have a little fun with this one. I'm actually going to put my book up here. Now, what I'm going to do with this one is I'm going to pause at certain places in the song, just like I did with You Are My Sunshine. And you're going to fill in the words, and then we have our singer who's going to help us out. So this is an example of musical speech stimulation. Ready? Take me out to the hall. Take me out to the
out.
buy me some peanuts and I don't care if I never get and it's root for the
whole
team. If they don't win, it's for it's 1, 2 at the old ball game. See, that was a very familiar song. Very good, good. Okay. Lost my microphone. I'm sorry. I'm not good with microphones. All right, here's another one. I think some of you are going to know this one. When the night has come and the land is dark. Is the only like you. Yeah, I got it. No, I won't be afraid. I won't be afraid. Just as long as you stand. Oh, darling, Oh, you're a quick study. And thank you, audience participation. Great. Okay, so rhythmic speech cueing. So this is the use of rhythmic cueing to control the initiation and rate of speech through cueing and pacing. So if you ever have somebody who talks really, really fast and you can't understand what they're saying and you know you want them to slow down what they're trying to say to you because you can't really understand what they're saying because they're talking so fast. Rhythmic speech cueing is here to help you with that. So we can use a client's hand, a drum, possibly a metronome to prime speech patterns or pace the rate of speech. This technique can be useful to facilitate motor planning for a patient with apraxia, to cue muscular coordination for dysarthria, and assist in pacing with fluency disorder. So that's very technical. I will give you an example. I have a teenage client. She's not diagnosed with epilepsy, but she does have seizures, and she also has autism. When she speaks, she runs her words together. So we have created little cue cards with little statements on it. For example, time for boom whackers. We use a metronome. She uses tapping on her body to slow down her speech, and it was like night and day when she started initiating this technique. She used to have a lot of repetitive phrases too, like walk, 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 walk. So we said, I want to walk. And then she would say the phrase and she would be able to stop it. So in this case, it not only slowed down her speech, it helped eliminate some of the repetitive speech patterns she had. And then she was also pronouncing a lot of the syllables of the words that she was glossing over before because she was talking so fast. So that's more of an example of its application. And then what's nice about the tapping on the body is if you teach someone to tap it on the body and they need help when they're in another setting talking to somebody, then they can self-cue. They don't need the tambourine or a maraca or something. They can just, hi, how are you? Things like that. All right, so orange group, come on, you're up. And if you're not an orange and you want to come up, if we have space, come on up. Are you going to put the tambourine on your lap? No? We have one more. You want to come on? No? So, orange shirts. Do you want to come up and play with us? It's the color orange. Do you want to play?
Only when I haven't like just a plain orange.
Only when what?
When I haven't plain orange.
Oh, just plain. Okay, so very good. That's fine. Just plain orange. Right, so what we're going to do is I'm going to turn on my metronome. After I get through all my security features on my phone. You can hear that? I'm going to grab the microphone and bring it to the chair. Actually, I can hold this. All right, so all I want you to do is repeat what I say and play the rhythm on the tambourine. And we're going to do it to the beat of the metronome. All right? So everybody got? We're going to do the Java Jive. I like coffee. I like tea. I like the Java Jive. It likes me. The coffee and tea. The Java and me. A cup. A cup. A cup. Very good. Not hard, huh? Okay, now somebody else. Let's see. Let's go a little faster. So what's nice about rhythmic speech cueing is you can adjust the tempo of your speech. So we're going to push the tempo up 5. All right, one more try. Right, a little fast. Here, you know what? I'm going to make it a little faster than that. So, because normally we don't talk like this, so I'm pushing the tempo to make it a little bit closer to your normal speech rate. I like coffee. I like tea. I like the Java Jive. It likes me. The coffee and tea. The Java and me. A cup. A cup. A cup. All right, that was better. See, that was a lot smoother. That was much closer to the speech rate. Very good. Thank you. So that was our demonstration of some rhythmic speech cueing. You guys are a splendid audience. Yes, never underestimate yourself. Okay. So vocal intonation therapy. So this is the use of intone phrases, stimulating the prosody, inflection, and pacing of normal speech. It's done through vocal exercises. Now you hear, oh, all right? Inflection, pitch, breath control, timbre, and dynamics. So vocal intonation therapy is a more structured approach to vocal training. It's not necessarily to train you to be an opera star. So it's just to help with those various speech needs that you may have. Breath control is very important when you're talking. You don't realize how much you utilize your breath support until you're running 10 miles and you're trying to talk. So therapeutic singing is singing. So you use singing to stimulate and facilitate initiation, development, and articulation in speech and language, as well as to increase functions of the respiratory apparatus. So a lot of these techniques focus on the breathing. Breathing is very, very big. Oromotor and respiratory exercises, again, some more respiratory exercises. Utilize musical materials, exercises, sound vocalization, and wind instrument playing to enhance articulatory control and respiratory strength and function of the speech apparatus. So hand somebody a little recorder, and if you want to work on their tongue movements, you have them say sounds into the recorder. Getting them to use their tongues, activating the recorder as they're playing it. You may not necessarily have them play any particular pitch. You may just want them to be able to blow and tongue, as we call the music, at the same time. Working on that. And then also you can buy different shaped mouthpieces that require increasing motor strength around the mouth area. Now, developmental speech and language training is a more developmentally appropriate musical materials and experiences to enhance speech and language development. Singing, chanting, playing musical instruments, and combining music, speech, and movement. So this is what you would see a lot if you go into preschools, kindergartens, early childhood. That is the approach. It's multimodal in its application. And then lastly, symbolic communication training through music, musical performance exercises using the structure, instrumental or vocal improvisation to train communication behavior, language pragmatics, appropriate speech gestures, emotional communication and nonverbal language systems that is sensory structured. So, okay, so you're going to do what I do and sing what I sing. So we're going to do an example of this. Not make a mistake, but oh well, if I do, I do. Okay. Here we go, all right? So you're going to do the gesture and you're going to imitate the song as best as you can, all right? Me, myself, and I. Me, myself, and I. You, yours, we. Yeah, and be careful of your neighbor on that one, okay? How are you today? How are you today? I'm fine, thank you. I'm fine, thank you. Let's see. I forgot my we. Where are you going tonight? Where are you going tonight? I'm going to bed. I'm going to bed. Okay. So we have we. We'll just make it general. So if you have like we, say, how are we feeling? How are we feeling? We are feeling great. We are feeling great. Very good. Okay. So does anybody have an idea what I was trying to teach in that one?
Reflection.
A little bit of inflection was in there, but what about the gestures? How were the gestures used in coordination with the words? Pronouns, personal pronouns, yeah. So I, my, myself, and I, we're always here. You, yours, we, to show more of the group. So if you have somebody who's struggling with those personal pronouns, and they say, it's my turn, and they're handing you an instrument, you know, you can use the gesture and you can teach little musical phrases to accompany the song. Me, myself, and I, it all refers to me. You, yours, we. All right, some cognitive things. Musical sensory orientation training is the use of music presented live or recorded to stimulate arousal and recovery. So this will be used more with individuals who are recovering from a head injury, who may be just coming out of a coma. Then we have musical neglect training. Involves active performance of exercises or non-musical instruments, structured in time, tempo, rhythm, and it is focusing on expanding the field of vision. Musical neglect and expanding the use of those arms, legs, limbs, or whatever that may be neglected. And so you can, for somebody who may be neglecting their right field of view, you can station musical tone bells around a table, and da 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 da, teaching the pattern, da 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 da. And so they learn the pattern, and then by ear, they can tell whether or not they are playing the pattern correctly. And if they're not hitting the bells in their field of vision, that will cue the individual to look in that direction and respond. So that's using the music to help a person learn to go into the field in which they're neglecting. And you can use that with limbs as well. So if they have a limb or a leg that they may be neglecting, using that kind of the therapeutic timp thing, and having them, you may just start with simple hand movements, reaching for a target, and then you may progress to grasp, and then you can, as the motor movements come back, you can make more complex patterns and things like that. So that's musical neglect training. Auditory perception training. Discriminating and identifying different components of sound: time, tempo, duration, pitch, timbre, rhythmic patterns, speech sounds, et cetera, et cetera. So we do this all the time. So you're sitting in your house and you hear bang. You're like, what happened? You're using your auditory perception to say, that was serious, I need to look into that. You know, someone's outside and they say, hey, Dad. All right, that alerts you right away, auditory perception. So even that would be pitch and timbre, the degree in which somebody says something, leave me alone. Leave me alone. You can discriminate the intensity of speech. That's all part of auditory perception training. So musical attention control training is active or receptive musical experiences using pre-composed performance or improvisation in which musical elements are cued, different musical responses. Now, what we did when we first came in, our very first application, was a music attention control training for sustained attention. If we were to focus more on selective attention, I would have said, all right, here's a beat. And I'd have you all play that beat, get that beat really solid. Then I would have stood up and started doing something really goofy. Try to mess you up. So selective attention says that despite what other distractions are in your environment, you need to focus and keep this beat going, no matter what craziness is going on in the environment. You can focus on that stimuli and block everything else out. You do it all the time. You just don't realize it. If you're sitting in a busy work environment, where I work, it's drums and people banging and singing and the walls are thin. I sit at my computer, I feel it through the floor, I hear it down from the ceiling, I hear it through the walls. If I didn't have selective attention, I wouldn't get any work done. So it's a good example of that. All right, we're going to play a little game. What time do I have? Am I doing okay?
5:19.
All right, 15 minutes. We're doing good. All right. So all I want you to say is if what I am doing is the same or different. So all I want you to do is shout out and tell me. All right, I'll give you 2 examples. Tell me if it's the same or if it's different. Here's the first. Here's the second. Same, very good. That's the first. Different, yeah. Same G7, G. One little note change on that one. Very good, okay? So, la 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 la. First. La 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 la. Okay, what did I do differently that time? Yeah, I held the top note. Very good, very good. Okay, so these aren't too hard. Okay, got it? Okay, very good. All right, auditory perception training. So, you're in the yard, you can tell the difference between a cat and a dog. Your auditory system is very, very fine-tuned, which is fun. Okay, onward. So we have a few other techniques. We have musical mnemonics training. It's the use of musical exercises to address various memory encoding and decoding, recall functions, immediate recall of sounds, using sung words, using musical stimuli. It may be used to address acoustic functions. Acoustic means repeating back, imitating things. Music stimuli may be used as a mnemonic device. Everybody sing along. A, B, C, D, E, F, G, H, I, J, K, L, M, N, O, P. Do that. Mnemonic device. How did every kid growing up, or almost every kid, what's your ABCs? I learned the French national anthem by singing it. That's all I remember now anyways, but mnemonic device, okay? So you use a lot of it and you don't. Anybody know that Jenny number? It says 8675. That song, that, yeah, everybody's singing around. Oh, I know that. So even though it's fictitious, they used a mnemonic device in that song. So, and I believe people actually went up and called that number to see if it was like, yeah, crazy. And who else used it? A commercial for Empire.
Oh, yeah, with
The carpet, Empire carpet or flooring, they use a mnemonic device. 800, 2300, Empire, mnemonic device. And you may actually do it yourself and may not realize that's what you're doing. And then associated mood and memory training involves musical mood induction techniques. So this is setting the mood to help stimulate memory and access different memories. So in a sense, when you do reminiscence, you are using associated mood and memory training. So you set, like a lot of individuals who maybe experience memory loss have recall of music. So you can play songs and then they'll start piecing together events that happen with those songs. Like a good example is the wedding song that you and your spouse dance to at the reception. It brings back, my husband and I, we have a weird song, and it's, what is it? It's that Cheap Trick song, I Want You to Want Me. And every time I hear that song, it brings back the memories of where we were and what we were doing. Yeah, quite crazy. So, associated mood and memory. And it works both ways. You hear a song, you go, and maybe there's a bad memory tied to it. So in a therapeutic approach, you want to kind of help use the music and actually to positively influence memories in that sense. So if you notice, a lot of music incorporates emotions and feelings tied into that. And then music executive functioning, that's just music to do decision-making, reasoning, comprehension, and things of that. So I'm going to let you read through that because I'm running short on time, and we're not going to do that example. So I want to just kind of get through some of our studies. So music therapy applications with individuals who have epilepsy. We have different animal studies, case report, clinical trials. And evidence-based medicine suggests that listening to music, and right now it's particularly Mozart music, may help reduce epiform discharges and seizures. This is, some literature I read says that this is still controversial. So my response to that is that we need to do more research. Several small Taiwanese studies have shown that music therapy can be effective at reducing seizures. And but the mechanisms of the music therapy are unknown. They speculate maybe it has something to do with entrainment, mirror neurons, dopamine pathways, the parasympathetic, your heart rate, activation. So there's a lot of theories out there. Studies. One study was a bedtime study in which they played Mozart before they went to bed. And the other study, the 2018 study, was they had two control conditions. One was a non-music, one was a music. And they played music at an assigned time during the day for 2.5 hours. And they found that the music control group actually had less seizures. So those are just a few of the studies. So what are some music therapy applications? We could look at creating some music listening protocols in which individuals who may have epilepsy can then integrate into their normal lives. So at 3 o'clock, they sit down and they listen to their Mozart. Since right now, Mozart's the only music that I've seen they've used, so that would be another study. Does it have to be Mozart? Could it be your preferred music? Music therapy techniques, obviously, to address all behavior, psychosocial, emotional, cognitive, speech, language, and sensory motor needs of individuals. Now, in addressing the rare, this is musicogenic epilepsy. It's like, the question is, can't music cause a seizure. And yes, it has been documented. However, rarely in the paper I studied, it said 1 case per 10 million. So that's like really rare. And the solution is if you feel that you have a musicogenic epilepsy, then avoid music until you can factor out what is really triggering the seizure activity. And when they talk to people, they say it could be induced by listening, thinking about, or even dreaming about music. And sometimes the seizures don't happen immediately after they're exposed to the music. It may be delayed by several minutes. And studies suggest that maybe there's an active role or cause related to emotions triggered by the music because of the temporal lobe activity. So there's that emotional piece of music. So is it the emotions that the music creates causing it, or is it the music itself? So again, you have lots of research opportunities here. So again, the exact pathophysiology is undetermined. Now, there are other causes, sounds. You could have tones, pitches, and things like that that may cause seizure activity, but you just have to kind of know yourself and know what those triggers are. All right. And there we go. So here's some references for you. And we have any questions? Yes?
So my son had music therapy at camp every summer while he was younger, and they found it to be very motivating for him, but we couldn't get our insurance to cover that. Is that still an issue usually?
Unfortunately, yes.
Okay.
At our center, we accept county neon funds. We offer our own income-based financial aid. Sorry. And right now, we are also hooked into the autism and the John Peterson Scholarship. So John Peterson Scholarship, that's for individuals whose children do not go to the traditional school system. They may go to a private school, and then we can provide you additional funding for that. Yeah, but that is something we're constantly looking at. We're trying to get licensure with the state. Yeah, it's always a battle. Yeah, there have been rare cases, but no guarantee. Any other questions?
Is that why you see it more in hospitals, I guess, because it's rolled into the hospital?
Yeah. They roll it into another kind of, like they blanket it into their bedside. Yeah.
Every time our son's been in the hospital, he's got music therapy.
Yeah. Oh, yeah. And so because it's on their bedside protocols, it can be wrapped into. So whether or not you get it or not, you still pay for it.
Yeah.
So in case you know.
But it's just hidden.
Yeah, just hidden. Yeah. So we're still working on that, and sorry to say. But if you do have the neon's great. That's through Cuyahoga County. I think Lake County also has it. I don't know where everybody is from. You'd have to probably explore your own area to determine what kind of. Yeah. Yes.
My granddaughter does integrated listening.
Mm-hmm.
Are you familiar with that at all?
Is that through your OT?
Yes, it is.
Yeah, they have a lot of music.
Connected, she has music therapy too,
Mm-hmm.
but it's like this period of time she's done classical. Now she's in a different type of music that she does.
Yeah, it's probably related to some of those studies that are using like the Mozart effect. Now I know that the OTs have designed specific protocols for different, did you have to like fill out an extensive survey? Yeah, and they hook you into the right music listening program, yeah. Yeah, so a lot of it's brain balancing and has a lot to do with your brain waves and synchronizing brain waves and things like that.
There's a pillow that plays music at night on the granddad has an iPod in it that plays classical music at night.
Yeah, there's all sorts of things. There's, you can get stuffed animals that'll play music through them. Buddies, I think they're called. I didn't bring that resource with me, but they'll hook into the phone, Bluetooth in the phone, and their mouths actually move. And yeah, they're really high tech. It's like, wow. Yeah. So, any other questions? Well, thank you for coming.
Thank you.
And thank you for being a great audience and participating.